Mom, seriously, I'm trying to make a video. Can you give me 1 minute? Let's try this again. Hi, and welcome to the Spring Hill Equine Seminar. If you're new, like me, don't worry. It's gonna be fun. We'll give everyone a chance to grab some food and get comfy, and then we'll get started. Mom, I'm working here. You're always embarrassing me. Okay, I think we're about ready to go.
Hello, everyone out there. From Spring Hill Equine tonight, we are presenting to you our seminar on lab work. A little bit of housekeeping first. If you haven't signed up for Wellness 2023, signups are going on now, and your horse would love to have a wellness program for Christmas. It's what all the cool horses are getting for Christmas, so don't let your horse be left out. You can call the clinic to do that. We have signups available on our website. You can ask any of us when we're there. You name it, we'll figure out a way to get you signed up for wellness, and we can help you choose which plan is best for your horse and your lifestyle. So don't miss out on Wellness 2023. So let's talk about lab work. We come out, we draw blood, we do some stuff. Who knows what we're doing? So let's explain a little bit about what we're doing. Let's start about what the heck is lab work? And I've been guilty of using the Labrador Retriever for lab testing. As many of you know, when you come to the clinic, you get a complimentary CAT scan from Tony. So that counts as lab work as well. You can come get those for free. But laboratory tests are anything that help determine a diagnosis, help us plan a treatment, help us check to see if a treatment is working, or monitor a disease over time. So that covers a pretty broad range of things, which is what we're about to do. Oops, which reminds me, I forgot to tell you guys out there, if you have questions, drop them down below and we will ask them during the seminar. So don't be shy, ask away. And here's a list of some things that we can test. So you see it's a pretty exhaustive list of things that are available for us to do lab testing on. We can do blood, urine, poop, tissue aspirates, which means we stick a needle in and we kind of get a sample of the cells that are in there. Tissue biopsies are where we go in with a scalpel and we get kind of a for real chunk of it. We can do nasal swabs, ear swabs, hair samples, all kinds of stuff are available for us for samples. Basically, if we can take it off your animal in some way, we can test it for something. We'll talk at the end about, does that mean that we can get information from that? Or is it not the greatest test in the world? But anyway, that's the basics of what we're starting with lab testing. So we are now going to turn it over to Dr. Carter to start talking about what lab testing actually is. And we're going to start with the fun of metabolic blood work.
Thank you. All right, so for metabolic blood work, when we're talking about horses, we're looking at testing for two different diseases, one of them being Cushing's and one of them being equine metabolic syndrome, which encompasses insulin resistance. So one of the things that you might be thinking about when you're looking at your horses or when we come out to do wellness on your horses are a couple different profiles. So if we see a horse that is middle-aged to geriatric, which in horses we define that as about 15 years or older, a horse that has long hair, especially if it's curly or not shedding out very well, kind of loss of top line muscles, possibly suspensory ligament breakdown, a horse that is uncharacteristically drinking a lot or urinating a lot, or even has laminitis. We're starting to wonder if that horse might have Cushing syndrome. And then a different profile, and this can be in our younger horses. They're an easy keeper, often overweight, don't take a lot of food to be really fat, have regional adiposity, which means they have localized fat deposits, usually on their crest, behind their shoulder, and their tail head. And they may also have laminitis. We're starting to wonder if they have that equine metabolic syndrome with like insulin resistance. And some of the challenging things and why we may test for both is that some horses can have a combination of both, with the clinical symptoms and the blood work. And this is just showing a picture of what these horses can kind of classically look like. So on the left, you have the horse that has kind of lost the top line and is really furry with that little curl at the end. And then on the right, you have an overweight horse, especially at the neck, and you can even see in this picture that it has a large fat deposit behind its shoulder. So we come to the farm, we see these clinical signs, and we do take some blood samples. So one of the tests that we submit for is ACTH, and this level, if it is high, is what indicates that your horse does have Cushing syndrome. And when we pull this test, we take a couple things into consideration because it is a hormone, so it does kind of rise and fall throughout the year. So we often don't want to test during the fall because all horses, even if they aren't cushingoid, may be artificially high when we test. And then if we get these blood work results back and your horse is cushingoid, we would treat them with a product called Presend. And then on the other hand, we have insulin dysregulation with that equine metabolic syndrome type horse, and their insulin would be elevated if they do have this syndrome. So oftentimes we first start with diet and exercise if they're able to do so, and a grazing muzzle. And some medications that we might include depending on the horse is Thyro-L or metformin. And we often retest both these horses to make sure that their dosing is correct when they're on those medications. And changing gears, talking about when you're purchasing a horse, some blood work that you might want to consider. So commonly doing like a basic blood panel, which would include like a CBC or chemistry, is often done, so you get a baseline on that horse, especially if you do purchase it, and you can kind of trace their values over time. And then during pre-purchase, sometimes drug screens can come up, and that's something that you should touch base with your veterinarian and trainer if that is something that's applicable for your case. And a drug screen kind of tests for a kind of a gamut of different medications, but they can include non-steroidals like buterbanamine, steroids like dexamethasone, different sedatives, long-acting tranks, and that list is pretty long. So if you have any concerns, you can bring that up with your veterinarian so they make sure they do the right test for you. And then I believe that switches us to Dr. York.
Guys, I'm Dr. York, and I'm going to talk
From the top. All right, guys. Sorry about that. I was muted accidentally. So I'm Dr. York, and I'm going to talk about 4 different tests that we do, 2 of which, well, I'm going to back up a little bit. 2 of which you may have seen because they're a common part of our routine wellness. You may have seen them during your vaccine appointments, and especially if you're on the wellness plan, 2 of the tests I'm going to talk about are included in that. So they're probably pretty familiar to you. And then 2 that you probably haven't seen unless your horse has been sick and we've seen your horse for it, because they're to gauge our diagnosis and treatment of illness. So we'll start with the Coggins. Coggins is a very familiar term to everybody probably, but there are a lot of misconceptions about it. So we'll talk about what it is and what it isn't. So to begin with, there's no such thing as Coggins disease. Coggins is a test. It's not a disease in itself. The reason it's called a Coggins is that in 1970, a vet named Dr. Leroy Coggins came up with a test to test for the disease equine infectious anemia. So ever since then, we've called it a Coggins. It's just in our common lingo, but you may not know that it actually tests for equine infectious anemia. The other thing people think about this thing is that it's an annoying piece of paper that you realize expired the day before you need it for a horse show. So that's usually how we think about it, but there's actually more to know about the disease and the test than we often talk about. So EIA, or equine infectious anemia, is a blood-borne disease. So it's caused by a virus. And then what can happen with your horse is a variety of things, such as fevers, a low red blood cell count, and that's what's called anemia, as an equine infectious anemia, swelling, weight loss, and overall an eventual destruction of the immune system. These are things that are hard to diagnose, and sometimes not all horses will look as sick as others in the beginning of the disease. So it's kind of a general type of problematic situation that starts that you then have to diagnose with a specific test. So it's spread by biting insects, and that's usually the deer flies and the horse flies. Your horse doesn't even need to be on the same farm or particularly close to another horse that's positive to get it, because it is spread by those vectors. Now, unfortunately, there's no vaccine and there's no treatment. So if your horse does test positive for the disease, it's a big deal and it's reportable to the state. It's really something we hope nobody in our practice ever experiences, because it is a big deal if it happens. Because horses can't be treated and they're carriers for life, what happens if you have a positive horse is that there either is a choice of euthanasia or lifetime quarantine away from other horses. So it's really tough, something that we test a lot for because we don't ever want to have a lot of people experience this. So like we said before, horses can look healthy for a while at least, but still be positive, and that's why the test is super important to keep doing. So we hear this a lot. We come out for vaccines and we talk about doing a Coggins test. Oh, my horse doesn't need a Coggins. He never goes anywhere. He just lives on the farm. And that is unfortunately not a thing. So because those biting flies are traveling all around, your horse doesn't need to have contact with other horses in order to test positive. There's a lot of reasons why we have this test required a lot. You know, crossing state lines or selling your horse or boarding him or entering a showground or a public trail facility will require it. Anytime you need to quickly get your horse out of a place that might be having a weather event, like a hurricane here in Florida, you want to have your Coggins ready to go. But the most important reason is just for overall health and welfare of our horses. Because EIA hasn't been eradicated, we really, really need to make sure that horses are tested so that we don't build up a bunch of positive horses and then have a big outbreak where we lose a lot of horses. So super important to keep testing horses, even if, and we hope, there's a low probability that it's going to come back positive. You definitely want to have that ahead of time ready to go. So let's switch gears to another test we might do. And this is one of the things we'll be doing if your horse might be ill or if we're trying to decide if he has an infection. And it's called serum amyloid A. So SAA, as I'll refer to it, is an inflammatory marker that's made in the liver and then gets into the bloodstream, goes all around the body in response to infection or inflammations anywhere in the body. Doesn't have to be the liver itself, can be anywhere. And it's a really, really useful test for detecting infection and monitoring it during the course of illness. So it's really quick and easy. You can see the picture on the left there is actually the little kit that we use. It takes 10 minutes. It's a tiny little bit of blood. We put it down, we do something else, 10 minutes later, it gives us a number. And that can be very, very useful because a normal horse, a horse that's healthy or doesn't have an infection, will have very low numbers. So either 0 or our machine says less than 20. Whereas if you have a horse that's got a bacterial infection, especially, or viral infection, or even one that's starting, that number will start to go up really quickly. So if I have a horse that's just beginning to get an infection, it'll still usually give me a higher number than normal, which is really helpful. I can start treatment early and get the horse healed before major things happen. So bacterial infections give us the highest number. Viral infections also give us a high number, but bacterial infections, like a big bad infection somewhere in the body, is going to be the highest one we get. What doesn't cause it is things like allergy, or things like a hoof abscess, for example, where there's like a little encapsulated infection that doesn't go into the whole body. But things like autoimmune diseases, allergy, that doesn't raise SAA, so I can differentiate that from infection. The other useful thing about SAA is that once that infection is resolved, once our antibiotics have started working and are getting things taken care of, the SAA numbers go down really quick. So it helps me determine when I can take your horse off antibiotics. So here's a little case we might go through, and this is a real life thing, something I might use to determine in a situation just like this what direction I should go in treatment. So let's say we have a 10-year-old trail horse. I get a call. He's breathing a little heavy. He's doing a little bit of coughing. He doesn't look super sick. He's still eating, but it's August, and the horse just trailered into the area for a ride. I go out and look at him. I do a physical exam. It's not super exciting in either direction. He's got maybe a little bit of a raised temperature. It's 100.8, not super high. You know, whether that means he's going to get higher and it's turning into infection, or whether that means it's just August and it's a hot day and he's been moving around, it's not really clear. And I look at him and he's got a little bit of white nasal discharge, not anything super dramatic. So we do a serum amyloid A, and let's say we get a number less than 20. Remember, less than 20 is normal in our machine. I might be more inclined to say this horse has equine asthma. It's August. We get a lot of asthma in the summer. We can get a little white nasal discharge. But on the other hand, if I have a serum amyloid A that comes back at like 800 or even higher, I'm much more worried about infections such as pneumonia, such as a viral infection. And my treatment is going to be vastly different. So if I treat with the drugs that I would choose to treat asthma, if I give that to a horse that has an infection, that's the opposite thing of what that horse needs. So really, really useful to determine which way I should go and make sure I do the right thing for your horse. All right, we're going to talk about the next test. If we've ever come out to your house to look at a horse that's colicking, you may have seen this. It's called Lactate. Lactate is another quick and easy little blood test we have. So just a little background on what lactate is. Lactate is a byproduct of anaerobic metabolism, meaning really, really generally, if the body is using a type of metabolism when there's lower oxygen levels available, it's going to shift to this type of metabolism. So anaerobic, meaning not having air. So that's when we get a lot of lactate produced. So when the body has a normal amount of oxygen going around, the lungs are working, the blood's working, everything inside is healthy, the body uses aerobic metabolism. But when there's decreased oxygen supply, it shifts over to anaerobic metabolism, and that produces lactate. So when I take that little test and I get a high lactate number, higher than normal, it tells me that the tissues are not receiving oxygen in the appropriate way. So causes of that are varied. There's a few different ones we won't go into a lot, but the main reason we do this test and the main reason we see increased lactate is in situations with colic. So other things that can cause it, but mostly I want you to focus on colics because that's when we use it the most. So like I said, it's a quick little blood test, takes less than a minute. Once I put the blood in, it actually takes like 13 seconds. So I'll get an answer super quickly, and I can run that at the horse's stall in your farm. Normally an adult horse will have a lactate of less than 2. Foals will be a little bit higher, but very, very standard to have that really low number on a healthy horse. Okay, so the big reason we use this in colics is that lactate is a great way of quickly determining a type of colic that's cutting off the blood supply to the intestines, because that's a much bigger deal type of colic than a colic there's just an impaction, your horse is constipated, that sort of thing, but the guts are pretty healthy, nothing's dying in there. When you have a type of colic lesion where the blood supply is being cut off to the intestines, that's an entirely different type of treatment. we need to talk about what to do with that. So a lactate is a really quick way of me to look at that for you. So the first lactate sample we do can tell you how severe the colic is. And then let's say we get a nice low number and we're watching that horse, we're monitoring it, we're seeing if we can fix this medically, and we take another lactate a few hours later and it's still low, I feel good about continuing that treatment. But if that lactate starts getting higher and higher, it might tell me that what we're doing isn't working and we need to escalate to another level of treatment. So there's a study that looked at lactates and showed that high lactates tend to show the need for hospitalization or surgery. So basically, horses that were seen on the farm and had a lactate less than 2 rarely required referral to a hospital to perform surgery. If the lactate was over 3, it suggested that the horses might need to be hospitalized or potentially have surgery. And if lactate was over 6, it was associated with definite need for advanced intervention like surgery or not a good outcome overall. So very, very useful quick test to tell us what we need to do. Another thing we can do, if you look at the picture on the bottom right here, that shows a belly tap or an abdominocentesis. Another thing we can look at with lactate is taking a sample of the fluid that bathes the inside of the abdomen, but outside of the intestines. A little bit of that fluid we take out sterilely and compare that to the lactate from the blood. And then if we have a higher lactate in the belly than we do in the blood, that's another really strong indicator that the horse needs surgery and there's something strangulating in his belly. So now that I've probably completely terrified you with colics, let's take a deep breath and talk about something that we're going to do on a more routine basis again, which is a fecal egg count. So if you're on our wellness plans, you know that our plans include a fecal egg count once a year, and then the other time of the year that we see you, we will generally be deworming your horse. But let's talk about why fecal egg counts are super important. And before I do this, I just want to stop and press the big red flashing lights and say, please, if you're still rotating dewormers every 8 weeks, I would like you to stop that. And I'm more than happy to talk to you about why that would be the case. Because basically over the years, and I grew up doing rotational deworming like did most of us, over the years we created a lot of problems, and parasites and the worms we think about in our horses on a regular basis don't respond to dewormers like they used to, because basically we created a bunch of superbugs that are resistant to all the dewormers we have now. So I want you to stop the rotation deworming, and let's talk about what we can do instead that would be more effective for your horse and better to keep our drugs available for deworming. So nowadays we deworm based on fecal egg counts and if there's evidence that the horse needs it. The fecal egg counts, FECs, I'm going to refer to them here, give an exact count of the parasite eggs per gram of manure. So what that means is we come and pick up a piece of manure, we bring it back to the clinic, we run it through a machine, and it gives us a number. And what that number looks at is the number of strongyle eggs and the number of ascarid eggs, especially the strongyles. There's other types of worms that exist in the horse. Some of them don't get shed very frequently, some don't get shed in the manure, and some just you can't see in the manure very well. So usually we talk about those 2 types of worms, strongyles and ascarids. So when we do a fecal egg count, well, first of all, let me pause and say the goal in deworming horses is not to get a fecal egg count of 0. We don't actually want horses to have no worms at all. If you create a situation where a horse has no worms and then he's exposed to worms on a pasture, he's not going to have any natural immunity to the worms. So we always expect horses, which is different than people and probably different than small animals, but horses to have a low level of worms. And that's what's healthy for them. So what we want to do is eliminate the disease that's caused by the worms in your horse. Best time to check fecal egg counts is spring and early summer. That's when the worms are laying the most eggs. That's when we can see them come out of the little cysts they form in the small intestine and produce eggs that we can see on the fecal egg count. And what the FEC tells us is whether the horse is a low, a medium, or a high shedder. And there will be different horses in the population that just naturally shed different amounts of worms. Some have more immunity to them. Some, for some reason, just have a higher worm load. And what we do nowadays is that horses that with low and medium worm loads, we don't deworm frequently. We certainly don't deworm every 6-8 weeks like we used to. Those guys usually only need deworming once a year. We usually do that at the end of the year in the fall. when we look at our printout from our machine, 500 eggs per gram is what we consider our threshold. So anyone with less than 500 eggs per gram, we don't deworm, except for that end of the year appointment when we come out and deworm. The reason for that is that there's some types of worms you don't see in the fecal egg counts, including tapeworms. Everybody gets dewormed for those once a year, but certainly don't need to be doing the dewormers every 8 weeks. Another really useful thing you can do with a fecal egg count is do a reduction test. So you'll do a fecal egg count before treatment. You'll treat with the dewormer according to what your veterinarian recommends. And then 14 days later, you'll come out and do another fecal egg count, and you'll check the number of parasite eggs in that one. And what we can do is compare before treatment and after treatment and see how well that dewormer worked. So if that dewormer is effective, you should have a significantly lower number of eggs in the next sample. However, if that dewormer is, or that there's resistance in the parasites on your farm to the dewormer, you'll see a number that's not much lower. So that may have to mean altering your dewormer for next time. It may mean you have a parasite resistance problem on your farm. And what to do about that will be best determined by you and your vet together. So fecal egg counts are really, really useful. We do ours when we see our wellness patients in the spring, early summer, and then we tell you whether to deworm. We send you an email and we say, okay, this is what you should deworm with if you have to deworm at all. Okay, so definitely don't do your rotating. Fecal egg counts are the way to go. And at this point, I'm going to pass it over to Dr. Spizak, who's going to bring it over to. So, oh, we have a question.
And you're going to
do I worry about botfly larvae? I will take care of them in the same way I'm going to be doing other parasites. They are susceptible to the common dewormers we recommend doing once a year, most usually. So botflies are not a huge health concern. They cause some mild gastritis. They're unpleasant to look at. You can scrape them off the legs. But usually if I'm taking care of the worms that cause more health problems, I'll be taking care of the botflies at the same time. All right, Dr. Spizak's going to come and take over.
All right, thank you. I asked Dr. York to leave her last slide up for just a moment because I wanted to say that all of this that she just talked about fecal egg counts for our goat and sheep friends as well. If any of you were here at my goat seminar, you heard me talk about that for about 25 minutes. But just a reminder, please stop rotational deworming on your goats and sheep, only to deworm based on fecal egg count. Okay, we'll move on. So we're going to talk about some of our small animal testing as well as just some more general lab work that we can do on all of our species. One of the really big ones that I want to speak about is heartworm disease. We test for this in dogs routinely. Florida is a massive area for heartworm. The entire Southeast is. Pictured on the right side of the screen is the heartworm life cycle. And what this is a nasty little parasite that is spread by mosquitoes. If you live in Florida, you might have seen a mosquito here or there every once in a while, all the time. And it's spread through mosquitoes. When they bite infected dogs, get that larva into the mosquito and then bite uninfected dogs and infect them. Now, the big deal with testing for heartworm disease is that we can't just look at a dog and say that it's heartworm positive. In fact, if a dog gets bitten by a positive mosquito today and I test it tomorrow, I actually can't even find it. That's why we have to do routine testing. The way that the heartworm life cycle works is when the baby heartworm goes into the dog, it needs basically 6 months to turn into an adult heartworm. That adult heartworm actually goes into the pulmonary artery, which is one of the major vessels in the heart. And that heartworm, that adult heartworm, is what we are testing for with our blood test. It is a blood test. It takes, I think, 3 drops of blood, and we can run it in 10 to 15 minutes in clinic. So it's a very easy test and one that we recommend every single year on all dogs in Florida and generally in the Southeast. But it does take 6 months for that test to show positive. So if you newly adopt a dog, especially if it's one that came from sort of an unknown background, a rescue, a shelter, something like that, I always recommend a heartworm test when you adopt, but another heartworm test 6 months later to make sure that we're not missing a positive infection. Now, because it does take 6 months to show positive, we recommend starting heartworm testing at 1 year of age. So when you've got your brand new little puppy, we won't heartworm test that because even if it was bitten by an infected mosquito, we won't find those results. We will start them on heartworm prevention though. And just because your dog is on heartworm prevention every month, all year round, doesn't mean we get to skip the heartworm test. That's the other really big deal with heartworm. Two reasons. One, nothing is 100%. Dogs can puke their heartworm prevention. It might not be absorbed super well that month. They might hide it behind the couch. And so nothing is 100%. So even though you tell me, I promise, I gave that heartworm prevention every single month, I'm still going to ask you to test your dog for heartworm every single year. The other big deal with that is that the heartworm prevention that we give is a little bit of a misnomer. We are not actually preventing the mosquitoes from biting the dogs and infecting them with heartworm. What we're doing is we are killing those baby heartworms while they are susceptible to our medications in the dog's bloodstream. So, and our heartworm preventions can only kill those baby heartworms for about the first 30 days of the baby heartworm life cycle. And once they get too old, about 2 months of age, they don't work anymore. So if we miss even a single month, and again, that can be, doesn't mean you did anything wrong. It can just be that the dog took the treat from you and then walked away with it and spit it out. We can have those adult heartworms getting too old, and then our preventions no longer work, and we're going to find that surprise positive heartworm test. And that's when we have a conversation about figuring out treatment for those adult heartworms. Now, you notice I didn't talk about testing cats for heartworm disease. Cats can get heartworm disease, and it is a nasty disease in them too. The unfortunate thing is that testing cats for heartworm disease is a lot more problematic and a lot less straightforward than it is testing dogs. So we don't test them routinely. What we do is recommend routine heartworm prevention in all cats, so that we are trying to prevent that disease. And if we've got a concern for them having heartworms, there's some more complicated send off to the lab type tests that we have to do to actually look for heartworms in those species. All right, stepping off the soapbox now, moving on. So another big category of lab work is our complete blood count and chemistry. So CBC Chem is what you'll hear all of us refer to it as. Very routine thing that we recommend in a lot of patients. This little sort of screenshot here is just an example of what our machine prints out for us. And we have in-house CBC chemistry machines. So we actually get those results within a few hours, which is fantastic. We can get some really good information on all of our patients in just a few hours. So the CBC, or complete blood count, is looking at the cell part of the blood. All the blood running through all of our animals' veins is composed of both cells and fluid. Complete blood count is looking at the cells. So we've got a couple different cells in there. The red blood cells we all know and love, oxygen-carrying cells delivering nutrients and oxygen all around the body. As Dr. York mentioned, when we have low numbers of those, that's called anemia. Having high numbers of those can sometimes lead us to think dehydration, some other diseases. White blood cells are the other really big category that we care about. There are 5 types of white blood cells. I've listed them there. There will be a test later. But we can look at raises in those levels for things like infection, inflammation. And if we've got low levels of white blood cells, then we really worry that that horse or that dog or that cat is susceptible to new infections and new inflammation that can scare us. And then platelets, those guys are a little bit trickier to look at on our machines. Those are the clotting cells in our blood. So when you get a paper cut and then it stops bleeding a few seconds later, that's your platelets doing their job. You might see, it's a small image, but you might see in this image that the platelets in this patient were a little bit low. I will tell you this is one of the reasons why we don't just have machines doing vet med for us, because it takes a doctor to actually interpret these results. A lot of times platelets can be a little bit all over the place, but really everything's okay. So it just depends on the individual patient. All right, so the chemistry, the chem part of CBC Chem, this is looking at the fluid part of blood. Some of the big things that we care about on a chemistry is our organ values and our electrolytes. So the really big things, especially in dogs and cats, are going to be our liver values and our kidney values. And so we can look at those liver values and those kidney values, and those can't always give us a specific diagnosis, but they can point us in a direction to either figure out more testing, to do empiric treatment, things like that. So you can see a few examples of what we can find on our chemistry. So we've got our very sad pup in the bottom left there. That's an example of Cushing's disease in a dog, which is bit different than Cushing's disease in a horse, but does still require blood testing to diagnose. Now, we won't find Cushing's disease in a dog specifically on a chemistry, but we will see changes, especially in our liver enzymes, that can point us towards doing more specific diagnostic endocrine testing. And then we've got our internet famous diabetes kitty here in the middle. That is a big one that we can definitely diagnose in our dogs and cats on blood work. And then kidney disease is another really big one, especially if you've got an older cat, maybe going to the litter box a lot more. Needs some blood work, needs some chemistry to look at what's going on. And then doing a CBC and a chemistry is always a good idea in any sick patient because it can give us clues, but more importantly, it can actually rule some things out. I have a lot of clients that when I tell them, oh, the blood work is normal, sometimes people get upset about that and they feel like they wasted their money. They don't waste anything. You got to rule out a ton of potentially really scary things. And now we can cross those off our list and move on and look for more things. All right. So now kind of lumping it all together, pre-anesthetic blood work. This is more of a big deal in dogs and cats because we are putting dogs and cats under general anesthesia more often than like horses and goats and things like that. And so this is blood work that we run before anesthesia, hence the name. This can be something that's run a week or sometimes up to a month before, or it can be something that we run the day of anesthesia. Now, a lot of people aren't so sure about this, why we're doing this. Is this just because we want to, make more money? That's not the case at all. We want more information and we want to be able to individualize our protocols for each and every patient. Now, my recommendations for pre-anesthetic blood work are going to change based on the specific patient, how old they are, how healthy they are, what the procedure is, how long it's going to be, everything like that. But the baseline, the basic point here is that more information is better. So rarely is blood work going to tell me there's no way I can do anesthesia, but what it's going to do is it's going to help let me know if there's certain drugs that I should or shouldn't use, if I need to adjust my fluid rate, and if I need to worry more or less about the length of time of the anesthetic procedure. So basically, more information is better. Luckily, we have our in-house machines, so we can do all of this pre-anesthetic blood work the morning of the procedure most times, and we can have that really, really important information that lets me develop a better anesthetic plan and a more individualized, pertinent anesthetic plan for that individual animal. So I'm always going to recommend it, and we can talk about sort of what my recommendations are for each individual animal as we go on. And now we're going to bring Dr. Latcher back up, and she's going to finish us out with some myths in lab work. Oh.
All right. So as I hinted at earlier, just because there is a test that exists doesn't mean it does what you think it does. So let's talk about a few common myths. Hair testing. This is one of my favorites. It is not uncommon for me to get a hair testing result that tells me that this horse has, my personal favorite, is toxic levels of copper. That's one of the most common. Zinc levels are often off. We have some of these minerals that don't show up correctly in hair. Well, that's because hair contains a lot of those. So you can't do copper testing on hair because it's high in copper. So you're going to come up with toxic copper levels on every piece of hair you do, or you didn't do it right. There are some things we can use hair for. The big ones are exposure to heavy metal toxic metals, like arsenic is one we can find in hair, but we're not going to be seeing that your horse was exposed to arsenic yesterday. We're going to see that your horse was exposed to arsenic 30 days ago. In 20 some years of practice, even though I like to pretend I've only graduated 5 years ago, I have never used hair testing for anything. Maybe if I was on a TV show called CSI Horse Doctors of Gainesville, I might use it. But much like lots of things in those TV shows, it's not real. So please, please, please take hair testing with not just a grain of salt, but an entire salt mine. So, hair testing. Moving on to other mineral things. Blood tests for minerals can be tricky. There are some that work and there are some that don't. So for example, magnesium is one that we can test off of a blood tube. The problem is that tells me how much blood how much magnesium is in the blood. Magnesium is stored in lots of different places throughout the body. And unfortunately, the best way for me to tell how much magnesium your horse has is to cremate them and analyze the ash for magnesium. But that's less useful for getting you a valid magnesium test. You can see why that's not really where we should go here. So many magnesium supplements will recommend that you pull a magnesium level, and then your horse is either low or high, or this is the explanation for all of the things that are wrong in your horse's life, and their supplement will fix it. And we just can't really use a blood magnesium test that way. And this is true for a lot of minerals like that, but not everything. So it's definitely something that if you have a concern about it, you want to have a conversation with us about, is this a valid way to test this? Is there even a valid way to test for magnesium, or something similar to that? So just because you've looked up on the Google that there is a blood test for that doesn't always mean that it's a valid thing. Which brings me to Lyme disease. Oh my gosh. Can I just say that I'm really glad that we don't practice in a Lyme disease area? Oh, because there is no test for this that works well, other than, once again, a less than ideal test, which is a necropsy, where they can find it. I once went to a lecture with someone who does nothing but research Lyme disease, and I cannot think of a worse job. And she was discussing cases she'd seen. She was in a Lyme disease endemic area. She was located in like the county next to Lyme, Connecticut. And she had 3 horses that she presented to us that day. And the number one thing they all had in common was that they all did in fact have Lyme disease and had negative results on their blood test for Lyme disease. So this can be a tricky critter. And this is one of those places where we may say, let's pull a blood test. And what we're going to do is take the results of that and use it to potentially guide us forward. For example, if we pull that Lyme test on a horse who has, in our knowledge, lived in Florida its entire life, it's going to be negative almost undoubtedly. There may be tiny little numbers on there. They run 3 different things on that blood test. We may see like this little sort of background number, but it should be negative, right? If we're looking at a horse who just came from Florida its whole life and moved to the north, and all of a sudden we run that blood test and we have a high number, that probably means that this horse does in fact have Lyme or was very recently exposed to it. So now it's our job to say, okay, we have this high number. Do we also have a horse that has symptoms of Lyme disease, which is an entire lecture in itself? But do we see symptoms to go with a blood test value? And that's often what we have to do with some of these types, including EPM, which we're going to talk about next. But do we have a value on a test and a sign on a horse, and do those 2 things go together? And if they don't, then the one may invalidate the other. And that can be really, really tricky and difficult. And it's often where we pull in the experts. We don't see a lot of Lyme disease here in Florida. So every time I see a horse where I may be suspicious of it based on their travel history, we're going to run that blood test. And I promise you, I'm going to be on the phone with Cornell saying, okay, this is what I have in the horse. This is what I have in the test. What does it mean? And for fun, Lyme disease can be vaccinated against, sort of. It's an off-label use of the dog vaccine, but that also causes a rise in one of the numbers on the blood test. So then we have to figure out what to do with that. So this is probably the most complicated blood test on the planet. And you can never say, I did blood work on my horse and it has Lyme disease. It is way, way, way more complicated than that. And my favorite, and this one's common here in Florida that we see blood results on, is EPM. A positive EPM blood test only means that your horse has been exposed to EPM. We can have really high levels on that test. We can have potentially low levels. All it means is that your horse has seen the EPM organism, and that's pretty common. In Florida, that's like having a blood test for, have you been bitten by a mosquito? Most of us have. We would have a positive blood test for that. It doesn't necessarily mean that we got a disease from that mosquito. It just means we got bit. Same thing here. It means that the organism that causes EPM has gotten into your horse's bloodstream, but it doesn't mean that it is causing a problem. The biggest way for us to tell that is to do a spinal tap, where we take the fluid from around the spinal cord and we test that. The trick is, here's the fun part too, we also do the blood test at the same time. And the reason is it's very difficult to get that spinal tap without having some blood contamination. So we use the blood value to tell us how much contamination we got, and then we figure out a number from that. Well, we don't, but the lab does. So they figure out a number from that and tell us how contaminated our spinal tap was, and most of the time we're able to kind of extrapolate from that the correct number. But the EPM organism causes a problem when it gets into the spinal cord. And so if you don't have it there, if it's only been in the blood, then you have an exposure, but you don't have the disease. Now, if we have a situation where for whatever reason, we don't really want to do a spinal tap, but we're looking at a horse like the one on the screen here that has a focal area of muscle loss. And I'm not talking about a vague sense of unease that you're experiencing with your horse, or maybe they tripped once on Tuesday, but it was also a full moon and you got a new batch of hay. You know, and we're not talking about that. We're talking about a very obvious EPM symptom, like one focal area of muscle loss like this horse has. When we see something like that, we may pull a blood test as a screening and say, okay, do these things go together? It's not going to be the only thing we do. We're also going to potentially look for other causes of neurologic disease, and I promise you there's a lot of them, but the most common one is neck arthritis. So we are going to look at other things that may be going on with your horse, and again, we're going to put all of that together to determine, do we need to move forward with a spinal tap? Do we have a likelihood of EPM actually going on here? You know, what is our true potential for a diagnosis, and where should we go now? But I'm going to tell you, the number one gold standard way to know if your horse has EPM is to do a spinal tap, not a blood test. I know it, we all want it. It's easy, but it just means they've seen it. And what horse in Florida hasn't seen a possum? So next, let's talk about allergy testing. Same deal. I cannot pull blood and tell you what your horse is allergic to. It is widely available. It is advertised. It is all over the place. It does not work. And the reason is that, once again, it just tells us that your horse has been exposed to something potentially. Although some of the allergy blood tests I've seen, I question that, because I don't know that my horse was ever exposed to kapok trees. But anyway, so blood testing just says your horse saw oats. So like they're going to come back positive as being allergic to oats. Well, they've seen it. And so the body has created an antibody to it. That's just how that works. It doesn't mean it's a problem that's going to cause an allergy. The proper way to do allergy testing is what we call intradermal testing. And that's what's going on this horse here. You can see that we've taken a bunch of little tiny doses of allergens. So on here, there might be corn, oats, alfalfa. There's a myriad of pollens. The allergy testing is very regionally specific. So like here we'd have live oak and bahia and Bermuda grass and, you know, all of the things that we grow around here, ragweed. You know, the fun stuff like that that is likely to cause allergies in a horse in this area, we would put it underneath the neck skin, and then we would look at it in 4 to 5 hours, and we would measure how big each of those circles are. And if they're over a certain size, then that tells us that that horse is likely allergic to that item. And from there, we would create we call it a vaccine. It's not really that. It's a low level of the allergen that we then train the body. Bahia grass is not the enemy. It's okay. We're going to just slowly introduce it to you and hopefully get the body to tolerize to it. So I know that blood testing sounds a whole lot easier, and it is, but intradermal testing is 100% the way to go. So with that, we have done lab testing. I think all of lab testing, everything we can possibly know. We haven't talked about everything, but I do want to say thank you guys for everything. We don't do a December seminar, and sounds like we have a question. Also, one more time, before I get to your questions, go sign up for wellness.
All right. First of all, do you see horses with active EPM?
How often do I see horses with active EPM? This is going to be sacrilegious. In 21 years of practice, I can tell you that I have confirmed seen 3. Ask me how often I see neck arthritis, and it is probably weekly. EPM is way less common than the Google would have you believe.
Are horses at risk for ehrlichiosis like dogs from tick bite?
Are horses at risk for ehrlichiosis? That's a great question. And the answer is yes, I think it's Ehrlichia, but it might be anaplasma. Anybody know from tickland? There's a tick-borne one of those. There's actually 2 that happen in tick country. Luckily, we don't have them in Florida. And they are often, we can do a blood test for them. And one way we'll do it is a smear where you look at it under the microscope and you can see the little baby badnesses in there. But generally, if you live in an area where that happens, you will find that your veterinarian will start to treat based on signs, pull the test, and you'll wait for the blood test, but you're going to treat before you even know if it's positive. All right, there we go. If you think of a question at 2 o'clock this morning, call or text. I'm just kidding. Please do not call or text. Drop it down below and we'll answer it for you. So again, thank you guys so much for being here tonight. We appreciate every one of you.